Good day. Today we will be presenting on swine vesicular disease, a pen disease. Etiology. Swine vesicular disease is caused by swine vesicular disease virus, otherwise shortened as SVDV. SVDV is a member of the genus Enterovirus of the family Picornaviridae. It is currently classified as a porcine variant of human Coxsackie virus B5. SVDV is its only known serotype. It is suspected that during the 1950s, CVB5 had undergone a recombination with CVA9, and that is how SVDV is suspected to have formed. Species affected. SVDV is highly stable in the environment. It is currently only known to infect domesticated swine. However, there have been some instances recorded of subclinical infection acquired in humans.
So, geographic distribution of SVD is formerly endemic to much of Europe, but though it was eradicated with the exception of southern Italy. SVD also occurred in parts of Asia, last reported outbreak being in China in 1999.
Transmission. SVDV can be acquired either directly or indirectly through contact with the mucous membranes, broken skin, or via ingestion. The virus is not typically airborne, hence the class a pen disease. A pen disease indicates basically the lack of spread between pens. This does not occur unless through fomites or a communal environmental source like an open drainage system, for example. Again, SVDV is very stable in the environment. It can survive between a pH of 2.5 to 12, and it is relatively resistant to heat. It has also been recorded to survive up to 2 years in dried or salted smoked meat. And also, in other instances, it was recorded to be transmitted to pigs that were fed raw or undercooked infected meat. In terms of clinical signs, the primary clinical signs of swine vesicular disease are fresh or healing vesicular lesions on the feet, especially the coronary band, and less often other areas such as the mouth, lips, teeth, or snout. Other clinical signs include fever and sudden lameness. The lesions, they may be mild or inapparent, especially when pigs are kept on soft bedding. It should be noted that the lesions are similar to those of foot and mouth disease and vesicular stomatitis. However, the affected pigs usually do not lose condition and the lesions heal rapidly. Nervous system signs have been described, but they are rarely seen. The World Health Organization for Animal Health recommends that any outbreaks of vesicular disease in pigs should be assumed as foot and mouth until proven otherwise by means of laboratory testing. So if these lesions are seen, please assume it is foot and mouth and contact the relevant authorities or your veterinarian. These photos highlight the different clinical signs that can be seen on the hoof, the teeth, and the mouth. In terms of diagnosis of swine vesicular disease, it is confirmed by laboratory testing of samples of epithelium, feces, or serum from affected animals. Virus detection is by antigen detection ELISA, virus isolation, or reverse transcriptase PCR assay. Serologic diagnosis is by means of antibody detection, ELISA, or virus neutralization tests. However, it must be noted that low specificity may be a concern, particularly in older animals.
In terms of postmortem lesions, vesicles are the only postmortem lesions that will be seen as shown in the arrows on the photos.
These are the different differential diagnoses for SVDV, and as you can see from the images, the lesions are quite similar.
Treatment and control. There is no specific antiviral therapy for SVD, though in countries that allow treatment, supportive measures may be helpful. Outbreaks are controlled by quarantining infected farms and regions, tracing pigs that may be exposed, culling the infected, burying or burning the carcasses, and disinfection of the affected premises with 1% sodium hydroxide and flame guns, though other disinfectants like iodophores may be used. Preventative measures may be used, such as screening of imported pigs, as well as restricting of pork products that may contain the virus. When confirmed animal movement in the affected area is halted and markets are stopped. There are currently no vaccines available to combat the virus, and some strains often circulate without causing significant clinical signs, therefore making it difficult to detect unless routine surveillance is conducted.
With respect to public health significance, countries in free and fringe areas apply strictly enforced national preventative measures against the introduction of swine vesicular disease. Control over the importation of pigs and pig meat products from countries with swine vesicular disease. Forbid the feeding of animal products to pigs unless they have been processed through a licensed processing plant, and slaughtering diseased and in contact pigs once the disease has been identified. So, is swine vesicular disease zoonotic? Seroconversion to swine vesicular disease and clinical cases have only been reported in laboratory workers. Most symptomatic cases were mild and characterized by flu-like illnesses. However, one case of meningitis was associated with swine vesicular disease. In summary, swine vesicular disease is a pen disease caused by a porcine variant of CVB5. Swine vesicular disease can be transmitted directly and or indirectly between swine and rarely in humans. Some clinical signs include vesicles on different parts of the body and sudden lameness. Diagnostic testing include laboratory testing, ELISA, PCR, and serology. Differential diagnoses include foot and mouth disease, vesicular stomatitis, and vesicular exanthema. When swine vesicular disease is confirmed, the animal is slaughtered and the carcass is burned or buried. There are no commercial vaccines currently available for swine vesicular disease. Clinical cases of swine vesicular disease has only been reported in laboratory workers experiencing mild flu-like illnesses. These are our references, and thank you all so much for listening. That's all.